Okay, hey, it's Frank Cawley again here, and I am off camera once again. In our last video, we shared a common problem with the shoulder, which is known as a rotator cuff tear or tendonitis bursitis, and how we determine which is which. For this video, we're going to talk about and assume that you have a rotator cuff tear, and you want to know or determine the severity of that tear, which in physical therapy, we grade it on a 3-grade level, and I'll explain. So how we determine which level of tear it is as such. A first grade tear or grade 1 tear. The person generally will have some pain, especially with certain movements at end range or when really stressed, such as lifting a heavier weight than usual or doing a heavier task at work than usual, or maybe slept on that side for hours and it woke them up. And generally speaking, this person will have relatively close to normal movement, close to near normal strength, side to side comparison, and generally they're going to just complain of some pain or discomfort with certain activities. That's a grade 1 tear, and usually that entails maybe 5 to 10% damage of the tendon, because that's what we're talking about when there is a tear, a tendon tear, not necessarily the muscle. A grade 2 tear would be anything up to or greater than 50 plus or minus percent. It could be 70%, could be 30%. So when we determine these type tears, people generally come in with a lot of pain, a lot of discomfort. They have trouble with motion. Usually motion is restricted in more than one movement or at least one. They definitely have weakness when we strength test them. Typically, if we do the special test, it definitely comes up positive. And with the grade 2 tear, people will have a lot of trouble sleeping, and oftentimes this is painful with both activity, which is worse, but also painful with rest. A grade 3 tear, which generally represents a complete tear or full rupture of the tendon, would probably be 90 to 100% torn. Now, in many instances, people feel as though surgery is the only thing that's going to fix this, and that is true. Surgery is needed to fully repair that tendon. However, in physical therapy in the past, we have had people with grade 3 tears that have restored motion to functional capacity, had moderate to good strength, and most importantly, they had minimal to no pain with their tasks that were giving them so much trouble before. And we do that in very specific ways. But to determine if you have a grade 3 tear, number 1 is motion is going to be poor and greatly limited. Number 2 is your strength will be considerably weak compared to the good side. Number 3, the test that we do will clearly indicate a positive finding consistent with a higher grade or grade 3 tear. Now, as I mentioned, surgery is a permanent fix for this, but physical therapy oftentimes can alleviate the pain, minimize the motion and strength deficits, and restore function to very, very high levels. So surgery is not always 100% indicated. So that kind of concludes our shoulder grade of tear video. I hope you found this helpful and useful in determining maybe what you're suffering from. The most important thing to take from this video is this. If you think you're a grade 1 sufferer and you're ignoring it, you can bet that you are going to end up being a grade 2 sufferer over time. And if you're a grade 2 sufferer, you can bet that that person inevitably is going to probably evolve into a grade 3. So the moral of the story is, don't delay your care. Please address this as quickly as possible. And we at Cawley Physical Therapy and Rehab see rotator cuff related problems every day and are very successful in treating them. So I hope you found this video helpful, and I look forward to talking to you again soon. Thanks.